This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.
And Dr. Dwayne Ackerman is back to tell us what are some of the common symptoms, what to be looking for peripheral neuropathy. We've talked, of course, about your treatments, but what are the common symptoms, especially early on when you might not think you have it?
Believe it or not, loss of balance or not feeling quite as secure in your steps. If going up steps like at the Ford Center or a high school gymnasium or something, your balance isn't quite as good as it once was. That's kind of the first little trigger to go, something's going on. And then that just gets worse over time, and then you can have burning sensation, you can have tingling sensation, you can feel like your feet are literally on fire, and we measure the temperature and they're just as cold as can be. Basically the nerves stop communicating with the brain, and the brain doesn't know what's going on down there, and it makes assumptions about where our feet are at and what's going on, and then it just tumbles from there.
Well, as we age, and we hear that all the time, it's my most unfavorite phrase, by the way, but we have those sort of socialized expectations that, well, you're going to probably trip more, you're probably going to fall more because it's of your age, and that's not necessarily what you're saying here.
Exactly. It doesn't have to be that way, and if it already is there, we can certainly improve that, and we do it every day. We have patient testimonials all the time about the biggest thing they always say first is, my balance is improved. And when you really start boiling it down and start digging down with people, that's the thing that scares people the most.
Well, sure.
You don't want to fall, you don't want to break a wrist, a shoulder, a hip or something because you lose your balance then. And people don't talk about that because they're embarrassed.
Sure.
So it's not a conversation over dinner or anything like that. It's like, my shoulder, my hip, my rheumatism, blah, blah, blah. They never talk about my balance is really bad, and that's really what makes people nervous, and we can help that. And
so, having said that, if you are younger, if you're 40s, 50s, and 60s, and so usually age-related balance issues are not there, that should be a big red flag for
absolutely.
You, right?
That's your check engine light just blaring at you. And if you're diabetic, if you're a type 2 diabetic and have been diabetic for 20, 30 years and you're only 50 years old, you're probably having some of these symptoms, and it's a really bad road to go down. So nip it in the bud, the sooner the better.
Now, we've said that so often, and it's true. The sooner the better. And really and truly, you're just going to be treated so well. When you come to the office, you're so kind and so compassionate, and you're excited that you can help.
Well, it is, and it makes it fun for us.
Yeah.
Because we get people that have said there's nothing that can be done. They've been to Mayo Clinic, they've been to Cleveland Clinic, they've been down to Vanderbilt. They get these fancy diagnoses, spend tens of thousands of dollars on tests, and still find out, we can treat the symptoms, but we can't really help improve it and get it better, which is what we're able to do with our protocols that we use.
And the best thing to do for people watching today, just make an appointment.
Make an appointment, give our office a call. You can go on our website, you can see a bunch of patient testimonials there, ackermanchiropractic.com, or just call the office.
They're nice people. Give them a call. We'll be back with another nice person. The mayor of Evansville is here right after this.
This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.